Now, instead of flying an aircraft that carries 200 or 300 people, he's got an entire city. We're talking, 250,000 people at least. And he's okay flying that into the mountain?
Welcome to the East Anchorage Book Club podcast. I'm your host, Andrew Gray. Today we have two guests, both medical doctors who gained attention. They're speaking out publicly in support of the Anchorage Assembly's COVID mitigation ordinance, as our city's COVID rate grew to be the highest in the country, and our hospitals began rationing medical care. The first, Dr. Leslie Gonsette, works at Providence, taking care of hospitalized patients, many of whom have COVID. The second, Dr. Robin Ninefeldt, whom you heard in the opening clip, is a family practice doctor who has her own clinic here in Anchorage that takes care of rural patients all over Alaska. Let's get started. Welcome, Dr. Leslie Gonsette.
It's my pleasure.
So I did a little research before we got started. I see that you were born in Belgium, went to college in Florida, med school in Israel, and you did your residency at Tulane. Is that correct?
Yes, I did. And
then how did you end up in Alaska?
Actually, my husband, he is an engineer, and we were only supposed to come up here for 2 years. He was doing a field assignment, and we came up here and just fell in love. It was everything we had been looking for. I was hoping to go back abroad. I'd spent a lot of time abroad in my life, and I really liked sort of international global health, which is what my background was in when I went to medical school through Ben-Gurion University and Columbia University's collaboration. And that was kind of where we were headed. And then we came up here. It kind of feels like a little disconnect from the US, and the nature and the mountains just really made us fall in love.
And you're board certified in internal medicine and pediatrics, correct?
Yes, correct.
Currently working as a hospitalist.
Mm-hmm.
So when I was looking at one media outlet reported that you worked in the ICU. Is that correct?
So no, the group that I work for is called the Alaska Hospitalist Group. And we're a very big group that actually incorporates the ICU docs. So the intensivist critical care pulmonologist. So when it might sound a little confusing, but when I work in the hospital, I take care of anybody outside of the ICU. And I often get a lot of patients that are coming out of the ICU still be in the ICU, but they technically don't really need to be seen by an ICU doctor because they've stabilized. So I will go to the ICU. And also there's an intermediate ICU that we call IMCU that most of our COVID patients are at if they're not intubated. So I've spent a lot of times in the intermediate ICU, which is what we really technically call the COVID ICU.
Let's hear a clip from the Anchorage Assembly meeting on September 14th. You try to help Providence Chief of Staff Kristen Solana Walkinshaw answer a question from Assemblywoman Jamie Allard. We will hear Mrs. Allard and Dr. Walkinshaw before you offer to answer.
Go ahead, Ms. Allard. Thank you. Is it true that Providence Hospital is preventing or not telling patients and or the general public of methods of treatment to combat COVID because Providence doesn't want to discourage people from taking the vaccine?
That is not true.
Have you given alternate means of people to combat COVID yourself, given them other solutions?
Can you clarify what you're asking? I'm not sure what your question is.
Have you spoken to any patients giving them advice on other ways to combat COVID so that you don't discourage them from taking the vaccine?
I honestly do not understand what you're saying.
Have you given any advice to patients, asking them or telling them there are other ways to stay healthy to combat COVID?
Oh, of course.
You
yes.
have?
Yes, we counsel our patients on how to stay healthy every day.
Okay, and how to combat COVID?
There's one way to combat COVID, and that's vaccination.
Okay, so are you giving them other methods besides the vaccine?
So I'd like to speak to that because I do that
but I'm not
every
asking
day.
you, I'm asking her.
Would you like to defer to me? Okay. All right, so she would like to defer to me.
Thank you, Chair. So I have another question. You can answer this one if you'd like. Do you work at Providence then?
We both do.
Okay. So can you tell me how many unstaffed beds are at Providence right now?
I can answer your prior question.
So you
if it
can't
is relevant.
answer this one?
No,
I'm not going to
because
go back
I'm
and
not
forth with you. I'm
administration.
asking you a question. If you can't answer it, that's okay. I can go to
Yeah,
another doctor.
sure. Ms. Allard, we may need to move on.
That was a really memorable moment for me because I felt, although when you look at the words themselves, there's nothing overtly disrespectful or crass about anything that she said, but it was the way she said it and her refusal to allow you to answer the questions. I just want to know what it was like standing up there at that time.
Yeah. To be honest, as a healthcare professional, we all try to advocate for our patients. And I'd like to back up a little bit and
Sure.
tell you why we were even there.
Okay.
I work at the hospital, and all of us healthcare professionals work either in a clinic or in a hospital.
Mm-hmm.
But when you talk about a pandemic, the problem starts before that person gets to us.
Mm-hmm.
So as a healthcare professional, seeing the people come in with COVID and thinking, oh my gosh, had only they known what we knew,
Mm-hmm.
what we know, we really need to reach out and tell them, because unlike a heart attack or unlike a stroke, they come to us, we treat, they get better. It's almost sometimes too late. And we've been seeing this over and over again. And it was starting to become such a huge problem. A year ago or back in December, we didn't have the vaccine. So people that were coming up, we would treat them as best we could. And that's what we did.
Mm-hmm.
This time, however, the reason we were compelled to go on so many fronts is we have a very good, effective way, and we can go into that a little later, but we felt that we needed to go out and advocate as healthcare professionals to our community, because this is
Mm-hmm.
not what's just happening in other states. So one of the reasons we came is really because we were just suffering inside personally, just seeing the people coming and misinformation causing people to not listen to healthcare advice. And it's one of the reasons we showed up. So when she would, unfortunately, the way she sort of approached me was not in a way that I would have expected a leader wanting to hear advice and information from the actual people on the front lines, or who have the knowledge and the background to understand what is going on.
Mm-hmm.
So that made it seem disingenuous when somebody's up there trying to just give information so that a person can make a better decision, whether it's a leader or a patient. That should hopefully be met with open arms, open ears. And
Mm-hmm.
so when that's not what I got, it kind of was clear to me, okay, well, I'm not here speaking to a patient. I'm here in a political arena.
Right.
And that's really how it felt.
Well, I want to say you're very brave, because that was a really tense moment in the room. And I know that if I had been in your shoes, I may not have wanted to go back, but you did go back.
I did.
Let's hear a bit from your exchange with Assemblymember Allard when you went back on September 28th.
Those professionals who've gone to the same school as you, the same training, the years of dedication, just want to make people better, may disagree with you, are being threatened with their licenses taken. Do you find that is appropriate for the Federation of State Medical Boards to put out?
As a physician, we look to the Federal Drug Administration. We listen to science. We listen to sound knowledge, research, facts, and also what we've been seeing within ourselves in our hospitals. We don't decide to do vigilante medicine because we think...
Thank you, Chair. She won't answer my question.
Are you experiencing that kind of hostility in the hospital? Are there patients whose families or the patients themselves are, not trusting their doctor, like really feeling that there's some nefarious forces at play in the hospital itself?
It's a great question. And to everyone who's listening, absolutely. So yeah, it's been definitely surreal what's been happening, especially in the past year and a half, for the mistrust that's happened.
So it's, at the time of this recording, it's only been a little over a week since the Assembly passed the emergency COVID mitigation ordinance, which included mandatory masking in public spaces. Have you noticed any difference in your life and in the hospital in terms of the way people are behaving?
Before the mask mandate actually came about, surprisingly, after the first time that we went to speak and the media finally and the newspaper started sort of publishing the letter that started circulating, or our voices were starting to finally be shared to the community, I did notice a significant increase in people wearing masks. Not 100%, but it's much better, definitely. Unfortunately, we are still not, our numbers have plateaued and are not getting better. As you probably know, hospitalization have gone up. Sadly, the assembly meetings were definitely super spreader events, and we were shocked to kind of be having left that assembly room the second time and seeing that it was going to get drawn out for another week. We were all terrified, and probably is one of the reasons why our numbers are starting to go back up at the hospital. So those scattered events can really be a very big problem, because the nature of how transmissible this virus is. But I've definitely had a lot of people, give feedback that they were very happy that we were, as a community, as a healthcare community, finally coming out and telling people, what they need to do. Because I think a lot of people felt, well, I'm wearing a mask, but I'm getting dirty looks, and maybe it's not what needs to happen. And there's a lot of bullying going on, and just letting people know in the community that, hey, you're still doing the right thing. We're not out of it. I mean, we're the number one place in America and probably the world at one point for cases, per capita. So it's a really big deal.
So getting back to you testifying at the assembly, and, Dr. Solana Walkinshaw was on the Rachel Maddow show, and the national media was definitely following what was happening up in Alaska. There was a follow-up on the Rachel Maddow show about the assembly meetings themselves, and she spoke about the difficulty of getting healthcare providers to speak to the show, that she and her staff sensed that there was a real fear on behalf of doctors in Alaska to go on the national media and talk about what was actually happening here. I think because of fear of retaliation from members of the public. And so I'm so happy that you have showed up and continued to testify and continue to speak out. I want to ask first, have you had any reservations at all about using your voice?
No, I didn't. When I use my voice, I want to make sure, number one, that I'm speaking from facts and not from feelings or emotions, that I'm just there to be a voice to the healthcare professionals and to continue to confirm the science. And also how to equip people on how to be healthy, how to stay safe, and how to thrive and continue to have, a meaningful life and well-being. That's where I don't mind using my voice, when I feel 100% sure that I'm doing the right thing. But when I do use my voice, I think it's very important for myself and any healthcare professionals to do it in a way that doesn't seem politicized. Unfortunately, a lot of media channels can seem politicized. It's left or it's right. So I feel that our voice can be lost in the shuffle if that becomes the case. If I'm maybe speaking to one news, channel and not the other. Right. And so that's where we need to be careful, because it can, unfortunately, all of this is very political. And that's where one of the reasons I came to the assembly is to, especially the second time, to say this is not a political concern. The virus doesn't care what party you're in. Believe me, I've seen both sides come to the hospital and unfortunately pass away. And that's really where the voice can get lost, is if we seem to favor one side or the other. So my personal experience, or what I've really tried to do, is to err on the side of only one and not the other. When it's really something very neutral, like your podcast, I'm
Right.
always happy to speak out. And as far as, fear of retaliation by the public, yeah, there have been threats. The media correspondent of Providence have told myself and a few other physicians that have gone to the assembly meetings and spoken to the media that there have been threats, to healthcare professionals in general. So, it's unfortunate that that's the situation that we find ourselves in. So we have to tread lightly. But I think it kind of comes down to, well, what kind of message do we want to really bring out? What are we willing to sacrifice? The question that you're asking is incredibly important. Why? Well, going back to what I was saying about the vaccine, I want to tell everyone that really the worst thing you want to do is just even test yourself and get COVID.
Mm-hmm.
And the reason is, you may not think you're going to die from it. And probably you're right. Most people are not going to die from this, but you can get so sick and maybe not even have to go to the hospital. But it is something where we've seen, especially over the past almost 2 years now, that people have had some long-term consequences.
Mm-hmm.
And even people who are very healthy go on to feel like they can't breathe for several weeks, even though they were not the ones hospitalized. They can't think straight. They have kind of a fog. And there was an article by the New England Journal of Medicine that talked about how there was still some significant cognitive deficits and physical deficits years after, over a year after having COVID infection. And even as much as 12% of those infected couldn't even go back to work. And if you want to go into details, I remember there is a 30-year-old that I took care of in the hospital who was there for something else, but had not been back to work since December when he got COVID. 30 years old. Had such cognitive deficits that he couldn't go back to work. I had a 20-year-old who had previously no medical problems, who got COVID, unvaccinated, and had the monoclonal antibody, came to the hospital because she was still very sick and required oxygen. And within 5 hours of meeting her, she was on a ventilator.
Wow.
20 years
so
old.
Scary.
And she was on a ventilator for 11 days. I mean, and she had to be by herself. We had to call the family. You can't imagine the kind of things that we had to see and that she had to suffer through. So getting COVID really should be avoided at all costs. We don't even know the long-term effects, but what we're seeing now is very frightening. So number one, the vaccine is so efficacious that it should happen. Number two, booster shots are incredibly important. We're starting to see breakthrough in cases, and a lot of people are jumping to see vaccines don't work. Well, we knew that the immunity was going to start to wane after some time, and really 6 months is what we've been seeing. So boosters are very, very important.
Well, I want to thank you so much, Dr. Gonsette, for joining us
pleasure.
today. This has been really great. We're very, very thankful for the work that you do and for the fact that people like you not only are showing up and doing great work in the hospital, but are willing to speak out and tell the truth to sometimes people who don't want to hear it. And I know it's hard, and I am so appreciative of what you've done for Anchorage the past couple of months.
Andrew, I just want to finish off by saying I never feel like it's a waste of time or breath when people are actually willing to listen. I will spend as much time as it takes with someone who feels like they want to finally hear the other side. And I would spend numerous amount of time and my personal time to continue to speak out if people are actually really willing to listen. So thank you for this opportunity.
Hey, one more question. I've almost forgot. We ask all our guests this. Can you recommend a book to our listeners? Doesn't have to be your favorite of all time. Could be old, could be new. Just a book that you think we should read.
I actually love, and I picked this up actually during COVID because I really needed it. but it's actually by Alan Carr, Carr, and it's called The Easy Way to Mindfulness. And I absolutely love this book because it really helps you with a lot of the anxiety, a lot of the depression that we all face in society. And it was definitely exacerbated in my personal life when COVID hit. And it's something that I have really embraced also as a parent, with 2 young girls who has a lot of anxiety, raising them in this world. But it's been really eye-opening. And I actually really am glad that you brought that up because I felt like anyone and everyone should read this book.
Well, thank you so much. Sounds like a great book. I think we'll definitely have some listeners give it a try. And we hope to have you back again on the podcast someday. Thank you so much, Dr.
My
Gonsette.
pleasure. Yeah, thank you so much.
Now we have our second guest, family practice Dr. Robin Ninefeldt, who grew up here in Anchorage and came back to start her own practice. She wrote the letter to the editor in the Anchorage Daily News in September that was co-signed by over 300 healthcare providers. Welcome, Dr. Ninefeldt.
Thank you.
As far as family practice goes, you own your own practice?
Correct.
And you also are involved in drug and alcohol treatment?
I am.
So do you mind if I tell us a little bit about what your practice is like?
Yeah, not at all. I've got a pretty unique practice. I think it's really one of a kind in Alaska, actually. I travel to villages all over the state. So, Utqiagvik and Nuiqsut, Point Hope, and everywhere in between. And I practice the type of medicine that permits people to stay on their land. So say you've got a full-time home outside of Squinta. Well, I travel there and take care of you, keep your blood pressure in check, because it's my personal feeling that we heal better when we're at home. And if I were to insist that someone come to Anchorage and live out the remainder of their days might be shortened. So I have done their house calls is what I consider them, but I've done this type of medicine and telemedicine long before it became a fad with COVID.
That's really awesome. How long have you had that practice?
Since August of 2017, I want to say.
And did you create it, or did you take it over?
No, I did. It's my baby. Yeah. Prior to that, I had opened the clinic in Mountain View for Alaska Regional, and then subsequent to that, I helped open the urgent care that's also in Mountain View. But this is my main baby. And you mentioned drug and alcohol care. I also developed a MAT program. And
what, medically assisted treatment?
Exactly, exactly, right. And have done work with Wisdom Traditions and others to try to provide a wraparound, all-inclusive care of the person. Often we split things into medical and psychological and abuse history, you name it, but really they are all one thing. And so I take that holistic approach.
Speaking of Anchorage, the Assembly had several resolutions that they tried to pass encouraging COVID mitigation strategies. Mm. It seemed like they really didn't have any traction. Mm. So they moved towards the ordinance, which led to a insane series of nights and nights upon nights, of hours upon hours of testimony against the ordinance. Mm-hmm. What's your takeaway from that whole experience? Well,
I think, at least in my view, the writing was on the wall for a long time. Any time, and this is social science, sociology, psychology of we crazy humans, any time you put people in a restrictive environment, they are generally initially able to go along with it. However, once you release those restrictions, you will never, ever get people to go back into that restrictive box. They will retaliate like we've seen, at the Assembly, in publications, on, crazy type interviews. And it's Pandora's box. There's no putting the lid back on it, and that's simple social science. The idealist in me, of course, had hoped that people would care enough about one another that they wouldn't mind simply covering their nasty little mouth and washing their hands. But that seems not to be the case. I don't think that people are intentionally cruel. I think it becomes habitual. I think they really don't have a comprehension of what it is they're saying, but in mob mentality, it doesn't matter, right? An individual human on their own is generally intelligent and able to make reasonable decisions. But you put them in a group, and suddenly you have these rites of intensification, and it grows and grows and grows. And if you were to pull any person from that group and say, okay, a year ago, did you think you would be behaving this way? 2 years ago, would you ever let your child behave this way? They'll say, oh, no. But then we enter the realm of shame, right? And shame is so powerful in so many ways, and in addiction and our lives in general, our relationships. Shame also enters the world here in the form of embarrassment, and most humans, if they're embarrassed, will double down and become more hostile or come up with an excuse because we don't like to have egg on our face.
Can you talk about the disinformation?
To me, there is such dishonesty that is inherent in disinformation, and I cannot be convinced that some members of that body aren't aware that they are being dishonest, and they aren't aware that they are riling up the crowd, like you said, to a fever pitch. But I think one of the more kind things I was called was a witch with a W. It was actually a W. So, I mean, all in all, I was disappointed, and that disappointment really didn't come until after I, concluded my 3 minutes, and I saw on their faces, they too were disappointed.
We're out of time.
Thank you, Madam Chair.
It is midnight. We will meet back here tomorrow at 6 p.m. and start back up with testimony.
There was pizza purchased.
Twice.
It was a pizza party.
Twice, yeah.
And I think what you see on TV, what you see, when you watch the people testifying, is this enormous anger and outrage. But there was, there's one reason why those people showed up 7 hours a night after night, is that it was a very communal, fun experience for them.
Yes. So that term I used earlier, rites of intensification, we use that in religious psychology and sociology, but that is exactly what was going on here as well. So, a rite of intensification would be passing communion, and everyone knows what they're supposed to do, and or how to genuflect, or if you attend services where there's a call and response, everyone knows to do that, and it's just the learned behavior of the group. And just like you're saying, that is the learned behavior. They show up, they shout amen, hallelujah, just like they would shout amen, hallelujah walking into a place of worship. Do they do that while they're driving their cars? No. Do they do that at the grocery store? No. But in those hallowed chambers, right, whether it's the assembly room or their chapel, they have these rites of intensification, the call and response. It's the same thing, and that's a very powerful thing to us as humans.
It's a powerful energy to experience.
Oh, yeah.
Well, I want to move on a little bit.
Sure.
So you testified, and I'm thankful, because it was hard, and I'm glad you stood there in line for 7 hours. But you did more than that, and that is that you are the force behind the letter to the editor that was signed by over 300 healthcare professionals. Tell us a little bit about what the letter said and how the project came about.
Sure. So I decided on the 14th of September, which was when a number of physicians, myself included, showed up to the assembly meeting, and some representatives from Providence attempted to speak their piece. And we stood there with our lab coats, we called names, charlatans, and the like. And a certain assembly member took it upon herself to delve into a good 30 minutes worth of, in my view, hostile questioning.
And I'm just going to go ahead and say her name.
Sure.
It's Assembly Member Jamie Allard.
She did monopolize that time of questioning. Yeah. And when I was standing, a few feet away from people standing in line to testify, listening to the names that they were calling us, my mind just wanted to explode, because I had some patients that were standing in that same room, and I couldn't wrap my mind around how someone would have the gall to say what they were saying, to call the names that they were calling, to make the accusations of us being murderers, and then, go home and pick up the phone and want to refill on their insulin. Or that disconnect absolutely astounded me. And so that was when I said, you know what, okay, I need to write a letter. And then basically the letter said, look, not all of us could attend, but we absolutely support the message that was delivered. And the incredible thing about that, 308 signatures in 72 hours. Mm-hmm. I saw some follow-up posts from citizens on the ADN article, and a few in particular said, oh yeah, well, how many didn't sign it? Are you kidding me?
Right.
72 hours, and that's just Anchorage area providers.
And I can vouch for that there were other people wanting to sign it,
right,
but it was too late.
Right. And, I continued to get emails thereafter from, groups of physicians saying, hey, I'm going to add my name too. And I did go ahead and add it to my main copy, for future reference. But that, to me, was the best way I knew how to be the voice for others. That is one of my go-to, what's the word I'm looking for? Ethics, I guess. I hope to be the voice for others while they're still learning to find their own. And some people, they just don't like to be out in public, or they don't like to speak, or they don't want to rock the boat, or so many different things. But they are willing. Some are just plain exhausted. They are willing to say, yes, thank you for writing it. I support this all the way. And so that was the goal, and I think we accomplished that goal.
Speaking of voices, on September 28th, the mayor's opening statement, he actually says in his opening statement that he's made vaccines available, and he encourages people to get vaccines in consultation with their healthcare provider. He actually says that he encourages people to wear masks if they want to. Well, first of all, I feel like no one quotes those words because, I don't think anyone really believes it. Can you talk a little bit about Mayor Bronson and how he has participated in what's happening in the COVID pandemic in Anchorage right now?
Well, gosh, I just keep coming back to that word, disappointment. The old adage of actions speak louder than words, I think that's applicable here. I think people can claim all day long that, they said the right thing, they did the right thing, but that doesn't make it true. In any position of authority, I think it's an unspoken command that, you need to demonstrate good behavior, right? If, you're a parent and you're running around shrieking, screaming, like say, I don't know, at an assembly meeting, and then tell your child to sit down and be quiet and behave and have some manners. There's some hypocrisy there, and I think that we have an abundance of hypocrisy, unfortunately. Not everyone, I think, who is a hypocrite by, basic definition intends to be, but those people who realize that they're in the wrong have humility that goes along with it, and I think that's lacking. We've all been wrong. None of us is perfect. It's okay to admit when you're wrong and to get back on track. I think it would be more admirable if he were to say, you know what, I have encouraged people to wear masks, whether or not that's true 100% of the time, sure. And I am remiss in that I haven't practiced what I preach, and therefore I will now commit to wearing my mask when I'm engaged in, public activities. I say that I love Anchorage, I want to protect Anchorage, and therefore I'm going to behave accordingly. That would be okay. I don't think we need to have the whole cancel culture of, oh, you owe me an apology, yada, yada. No, just stand up and do the next right thing, as they say. Put the past behind you, get it right, say you were wrong, own it, and get on board. And for the love of God, help us, help you in helping the city. And, if you're, I'm really trying to remain tactful. If you are constantly saying that you're right, there's not room for you to grow, there's not room for you to learn, that's a really dangerous thing. And in fact, they teach private pilots that, before you ever even get to go up on a discovery flight even, you need to take heed and listen to the experts and listen to what's going on around you. He flew for years and years and years. Two pilot crew, right? If one person says, go around, you go around. That's it. You pay attention. They saw something you didn't, and you save your life and the life of everyone on board. Now, instead of flying an aircraft that carries 200 or 300 people, he's got an entire city. We're talking, 250,000 people at least. And he's okay flying that into the mountain?
Give us an action. What can we do so that Anchorage can move forward through this winter? I think for all of us, we're overwhelmed, stressed. We're not feeling great. I would say the city as a whole, not feeling great. Give us a way forward.
Well, I think, my first request would be, please don't be a douche. I mean, just, you have the power to be kind. Even if you're feeling like ripping everyone's head off, the whole, if you don't have anything nice to say, don't say anything at all. How about let that be your day? If you're feeling really uncharitable, wear your mask. People won't know if you're frowning, right?
Give us a book recommendation. Doesn't have to be your favorite of all time. Could be new, could be old. What's a book you want everyone listening to read?
So, recently, the book Better has been on my mind. I read it years ago. It's by Atul Gawande. And it's a quick read. It's worthy, and it's definitely applicable to our time now. He starts the book out.
He's a doctor.
He is. Yeah, he writes for the New York Times. I think that, here and there.
The New Yorker.
Yes, there you go. I turned on to him when he wrote Complications, another really good book. But he starts that book out by talking about Semmelweis and how, washing one's hands was such, an affront to reason. Why would a surgeon, why would a doctor, why would anyone in the hospital wash their hands? That's silly, right? But Semmelweis said, no, you know what? I think we should start washing our hands. And lo and behold, these infections went down, and
But not all of them.
Not all of them, correct.
Right.
It's gonna be all or none, right? But there was an improvement, right? And we have built upon that and continue to build upon that. That's, what we are sort of designed to do to make it better.
Dr. Robin Ninefeldt, it has been an absolute pleasure to have you on the East Anchorage Book Club podcast.
Thank you for inviting me. This is fun.
And now a few words from the woman who co-founded Anchorage Action with me, Yarrow Silvers.
I just wanted to talk a little bit today about when Dr. Ninefeldt and Dr. Gonsette first came to the Assembly meeting and testified, and what it was like and how I felt hearing the disrespect, fear, and anger that they were attacked with, and then about some of the things that happened after. So that day, having heard that the doctors had planned to come, some people had gotten there very early to make sure that they couldn't get in line soon enough to speak. One lady, however, brought Dr. Ninefeldt and Dr. Gonsette up during her testimony so that they could talk, and then some of the Assembly members asked them a lot of questions, and this made the crowd very angry. A big part of the doctor's testimony was about vaccines, and at one point someone had yelled out murderers. There was a lot of yelling, jeering, just a lot of hate, fear, anger, and a lot of belief that these doctors were out to hurt them. This was really hard to listen to, and it made me angry. I'm close friends with several nurses that have worked in the COVID unit this entire time, and I know them. They're my friends, they're my neighbors, and I can tell you with certainty that they are not part of some cabal. They are not killing people for money. They're not out there pushing microchipped vaccines, and they aren't refusing life-saving treatments. 2 weeks later was the first mask ordinance hearing, and I had gone back early to talk about the disrespect and the misinformation that had led to it. When I arrived, I spent probably about 30 to 45 minutes in line having a conversation with a man named Paul. Mostly we debated, always friendly and with respect, and towards the end he began sharing his beliefs and his fears about what was going on in the world and about the vaccine. I continued to go throughout the next 2 weeks of mask ordinance hearings to be supportive and to observe, and I continued to see Paul in the crowd. The small group that I came with got smaller as people couldn't take the vitriol, the anger, and the lack of civility any longer, and a couple of them actually got COVID, likely from being in that room. They got sick, but they were vaccinated, and they made it through okay. Around then, Paul stopped coming. Several members of the administration got COVID, and several other people who had crowded into this room got COVID, and then a man that had testified against the mask ordinance died of COVID. The mask ordinance was finally passed as an emergency order. A few days later, Paul died of COVID. It was really sad for me because I had spent the weeks prior in that crowded room, on the other side of the issue as him, but on the same side as human beings, full of life and with experiences, feelings, thoughts, and fears, and his death was so unnecessary. I was also angry because I felt like it was misinformation that led to his death. And I wonder if the people that spread that misinformation, whether it be for power, money, political purposes, or just to be contrarian, I wonder if they knew that these stories they told and the fear and the anger and the division that those stories created led to death. Would they still tell these stories? For some, I think that they do know, and I think that the answer is yes. But then I think that there's others that get so caught up in these stories and they don't know that they're lies. And I just wonder if they could really step back and really reflect on the things that they're believing and what they're saying. What would it be like to realize the consequences of that? And for these people, I guess I just want to end with Luke 23:24. Father, forgive them, for they know not what they do.
Thank you so much to Dr. Gonsette, Dr. Ninefeldt, and to Yarrow Silvers for coming on the podcast today. Special thanks to Corey Coolidge for making this episode listenable. Finally, lots of gratitude to you, our listeners, for tuning in. Reminder, we also host Zoom events. Please visit eastanchoragebookclub.com for more information. In 2 weeks, we will be interviewing former Anchorage Assembly member and recent mayoral candidate Bill Evans. Please tune in.